So we're going to start by palpating the fibula and the tibia. We'll start with the head of the fibula right here. So if you ask the patient to internally rotate and externally rotate their lower leg, you'll feel the head of the fibula moving underneath your thumb. You can relax. As you palpate down the shaft of the fibula, you may lose it under the musculature, but the most distal portion of the fibula is the lateral malleolus, which is right here. On the medial side, we have the tibia. The crest is the most anterior portion of the tibial shaft, which you can palpate down the anterior portion of the leg. And then we have the medial malleolus right here, which is the most distal aspect of the tibia. Slide on the table for me. And then we'll move to the ankle down into the foot. So we have the talus, which sits right between the tibia and the fibula. If you have the patient just relax but plantar flex their foot, you'll be able to palpate the dome of the talus anteriorly. So if you relax and put the patient's ankle back into neutral, you put your thumb on the medial aspect and your pointer finger on the lateral aspect, and if you move the foot back and forth, side to side, you'll be able to feel the neck of the talus, which you'll feel on either side of your fingers here. Then we'll move to the calcaneus. So on the calcaneus sits just below the talus. On the lateral portion of the calcaneus, about 1 inch inferior to the lateral malleolus, you'll find the perineal tubercle, which is right here. So if we come to the medial side of the calcaneus, just about 1 inch below the medial malleolus here, you'll find the subsyntactium tali, which is a shelf on the calcaneus for the talus. And then just below that, on the most inferior portion of the calcaneus, on the medial side, you have the medial calcaneal tubercle, which is right here. So now we're going to work from the phalanges, and we're going to go back into the metatarsals and then the tarsals. So we have the phalanges here. It's right here. Palpate each of the phalanges. And then following the phalanges, we have the metatarsal. So you can palpate the phalange, and then you get to the metatarsal. Right here, you'll feel a knobby end to it. That'll be the head of the metatarsal. And then you get the shaft of the metatarsal, and you'll palpate down just before you feel a drop off, and you'll get to the base of the metatarsal. And that will be follow suit for each of the 5 metatarsals. Palpate down. You start at the head, palpate all the way down until you get to the base of the metatarsal for each one. If you follow the first metatarsal all the way down to the base, just when it starts to drop off, the next bone lying right here will be the navicular. So you can palpate that medial all the way across to follow in line with the second metatarsal. So if you follow the third metatarsal down, you'll get to the first cuneiform, just after the drop off of the base. If you follow the fourth metatarsal down, right after the drop off, you'll get to the second cuneiform. And following the fifth metatarsal down, you'll get to the third cuneiform right after the drop off. Now the fifth metatarsal here is this is the styloid process of the fifth metatarsal. And if you put your thumb there about 1 inch from the styloid process of the fifth metatarsal, you'll come to the cuboid bone, which is right here. Moving from the cuboid, lastly we have the 2 sesamoid bones, which are going to be on the plantar surface of the great toe. So you'll have the medial sesamoid bone, and then you'll have the lateral sesamoid bone. They'll feel like 2 P shapes right under your thumb as you're palpating. So now we're going to palpate the musculature of the lower leg and foot. If you have trouble finding a muscle, your best bet is to have the patient contract the muscle, ask them to relax, and then you'll palpate. You will never palpate a muscle while it is contracted. So we'll start with the tibialis anterior muscle. I'm going to ask the patient to dorsiflex and invert their foot, and you'll see the muscle pop out here, and you can also see the tendon here. So I'll ask the patient to relax. Use 2, 3, 4 fingers, however many you need, to palpate the belly of the muscle. Then we'll come down to the muscle tendon here, right to where it inserts. Then we're going to move to the extensor digitorum longus muscle. So that muscle is going to be hiding underneath the tibialis anterior. So if you just start around the area of the ankle, so if you ask the patient to dorsiflex and extend their toes, you'll see the muscle tendons popping out from toes 2 to 5. You'll see the tendon right here. So ask the patient to relax, palpate that tendon, and you're going to palpate all the way down to the most distal portion of each of the digits here. All the way down, coming back. Again, palpating all the way to the end. Make sure coming back to that common tendon before it splits off to each one of the digits. Next is going to be the extensor hallucis longus muscle. Again, that's going to be, the belly of the muscle will be hiding underneath other musculature, so we'll start at the ankle. So if you ask them to flex or extend the great toe here, you can also apply some resistance and you'll see that tendon popping out nicely right there. Relax for me, palpate that tendon here, all the way down to the most distal portion of the toe. So now we'll move to the lateral part, so we'll get to the peroneals here. So just behind the lateral malleolus, you'll find the two peroneal tendons. So the peroneus brevis is going to be the first one that is just behind the lateral malleolus. So you'll start about halfway down the lower leg. You'll palpate down here. Again, you can use 2 to 3 fingers. Once you get to the tendon here, so if you have her evert, her foot, right here, you'll see that tendon pop out nicely right there. That's going to be the peroneus brevis muscle. So relax for me. Palpate that tendon right there. So the peroneus brevis is going to go to the bottom of the base of the fifth right here. And then we'll have the peroneus longus, which is going to be just below that. So again, if you have her evert your foot, thank you. Relax for me. You'll palpate here, and you're going to come all the way down. And this one's actually going to wrap around to the plantar aspect of the foot. Okay? And then the tertius is going to be anterior to the lateral malleolus. So that's going to come across here. So if you can evert your foot, dorsiflex, perfect. That's going to come across this way. And that's going to go to the top of the base of the fifth. Tertius goes to the top, and brevis goes to the bottom of the base of the fifth. Tertius, T for top, brevis, B for bottom. So just posterior to the medial malleolus, we have the 3 muscles known as Tom, Dick, and Harry. The posterior tibialis muscle will be Tom. The flexor digitorum longus will be Dick. And then the flexor hallucis longus will be Harry. So for the tibialis posterior, you're going to have them plantar flex and invert their foot, and you can see that muscle tendon popping out really nicely. So you have them relax, palpate just behind that medial malleolus. Then you're going to come to the plantar aspect of the foot. You're going to palpate all the way across that insertion. Next, we'll go to Dick, which will be the flexor digitorum longus. So again, you can have them plantar flex and invert, but also ask them to flex their toes under. You may not see it, but you can feel that muscle tendon right underneath your thumb. So have them relax, and you're going to palpate all the way across to the bottom of the foot, and then you'll come all the way up to the most distal portion of all of the phalanges right here. Okay, and the last one will be the flexor hallucis longus. So again, you'll palpate just behind the medial malleolus. You can have them plantar flex and invert, bring their toes under again. If you find the first 2 tendons, you'll feel that third one following just suit. So have them relax. You'll palpate, again, following all the way up the great toe. Okay, I'm going to have you flip over for me. So now we're going to do the gastrocnemius and the soleus. So for the gastrocnemius, if you can easily just put your leg right up underneath of their foot, and you can have them plantar flex, so just tell them to push into your leg, and you'll see the gastrocnemius pop out nicely. Relax for me. And then you're going to want to use 3 to 4 fingers to palpate the entire gastroc muscle. So we have the medial head of the gastroc here, and then we have the lateral head of the gastroc here. Make sure you remember that the gastroc muscle does cross the knee to originate on the posterior aspect of the femur. So make sure you're palpating the entire length of the muscle when you are palpating the gastroc. The easiest way to do your best to cancel out the gastroc just to get to the soleus, if you flex the knee a little bit, bringing their foot up on your leg, you can ask them again to push into you. And then you'll see that the soleus is going to become prominent around the sides of the gastroc. So you can relax for me. You can put their leg down, and then you'll palpate on either side of the gastroc, coming right down into the Achilles tendon where the gastroc and the soleus meet. So we're going to start with the ligaments on the lateral ankle. So the first one is going to be the anterior tibiofibular ligament. It's going to go from the tibia to the fibula. So the lateral malleolus is the most distal portion of the fibula. So if you just put your thumb right on there, you can palpate across. That's going to be the anterior tibiofibular ligament right here. So next we'll have the posterior tibiofibular ligament. You're going to have to palpate kind of deep to push back. You're going to palpate just posterior to that lateral malleolus. So then we'll come to the anterior talofibular ligament, which is going to go from the talus to the fibula. So you're going to palpate across, and you'll be able to feel the talus underneath your thumb, and that's how you know where that ligament is. Then we'll come to the calcaneofibular ligament, which is going to be just inferior to the lateral malleolus. You'll palpate just inferior to the lateral malleolus here. And then we're going to come posterior to the posterior talofibular ligament, which again, you're going to have to palpate deep back here to get to that. So next we'll move to the bifurcate ligament, which goes from the calcaneus to the cuboid and the calcaneus to the navicular. So we'll go from the calcaneus to the cuboid, which is right here. It's in a V shape, and then we'll go back, and we'll go calcaneus to the navicular, right across here. That's going to lie over the sinus tarsi, which is this indent or this space right here. So next we'll move to the plantar fascia, which is on the plantar aspect of the foot. So that's going to go from the calcaneus all the way up to the heads of the metatarsals. So when you palpate that, use a few fingers here, palpate all the way up to the heads of the metatarsals, making sure we get the medial and lateral aspect of the plantar fascia, or you can use your thumbs when you're palpating as well. The lateral portion, and then we'll palpate up to the medial portion. So I'll move to the medial ligaments of the ankle. So the ligaments on the medial aspect of the ankle are known as the deltoid complex, so we'll learn them as one complete complex. So off of the medial malleolus, you'll palpate. You're going to palpate in this fan shape coming across this way. So always going back to that medial malleolus in this fan shape right here, just like that. So it's going to span about this far. And then from there, we'll go to the spring ligament, which goes from the sustentaculum tali, which we learned is about 1 inch inferior to the medial malleolus. You'll feel that ridge, and you're going to come across to the navicular, and that will be your spring ligament right there. So on the posterior aspect of the calcaneus, you have the calcaneal bursa. That lies just between the Achilles tendon and the calcaneus, and what that bursa does, it's a sac of fluid that reduces friction. You won't feel it when you palpate, but knowing where it is very important in case of inflammation. So then we'll move to the posterior tibial artery, or the pulse. So if you go to the medial malleolus, you have Tom and Dick muscle tendons here, and you'll get to the posterior tibial artery, and feeling there, you will feel the pulse just posterior to that medial malleolus. And lastly, we have the dorsal pedis pulse. So if you ask your patient to dorsiflex and invert their foot, you'll see that tibialis anterior tendon. If you come just lateral to, they'll relax, coming between digits 2 and 3, up right just below the ankle joint, feel right there, and that will be the dorsal pedis.